Okay, so what's the final outcome of inflammation, right? So there's three outcomes of inflammation. The first one is resolution of inflammation. So the tissue has been cleared of foreign substance, of bacteria, and the tissue returns to normal structure and function. A second outcome is chronic inflammation. So say, for example, you develop leg ulcers that just don't heal. Uh, that's going to result in ongoing inflammation, more macrophages, more neutrophils, more inflammatory proteins, more cytokines, and the process will just fester on and continue. Okay, so that's one potential outcome. And lastly, scarring and fibrosis, meaning the tissue was so badly damaged or injured that the tissue can't be repaired, but it's replaced through the action of fibroblasts, which are cells in the tissue that make collagen, and it replaces the normal tissue with scarring and fibrosis. Okay, and that part of the tissue doesn't return to normal function. So if you can imagine a severe laceration or injury to your leg, it may not return to normal function. It may result in scarring and fibrosis. Okay, so let's look in the middle, acute inflammation, and we'll go upwards. So the the cause of the inflammation is removed. Okay, and now there's three possibilities. Resolution, so the tissue has been repaired and everything returns to normal. Regeneration, meaning that the fibroblasts have repaired the tissue, they've laid down new collagen, and there's been no tissue loss. Or healing by fibrosis. So the tissue was so badly injured and so inflamed that there's been tissue loss and cellular loss, and now the fibroblasts just lay down collagen and form a scar or fibrosis. Okay? If we go to the bottom and the inflammation continues, meaning whatever's causing an inflammation is just persisting. So say it's an infection that just can't be cleared. Well, you can develop the formation of pus, which is really just the foreign substance, such as a bacteria, and it can lead to an abscess, so suppuration, or it can lead to chronic inflammation because the immune system and the inflammatory system is saying, I'm just going to keep on creating more inflammation until I can clear this foreign substance or infection. So when we think of acute versus chronic inflammation, they're they're actually very different, right? Acute inflammation wants to deal with an injury or an infection and then heal from it, right? So a chemical injury to your skin, or frostbite to your skin, or a cut to your skin, or say you have trauma such as a broken bone from skiing, and you have bruising and tissue injury around the fracture. It wants to acute inflammation wants to repair that. Allergic reactions such as seasonal allergies or a reaction to a medication, an allergic reaction to a medication, will set up acute inflammation until it settles down. A burn, such as a sunburn, or a burn from spilling oil on your skin, is going to lead to inflammation until it's healed the area, and then the acute inflammation will settle down. And lastly, and definitely not the least important, infection, right? So any types of infection will lead to acute inflammation to fight the infection, right? So always see acute inflammation as part of the innate immune system. Okay, let's go over to chronic inflammation. So these are more ongoing conditions. So cardiovascular disease, where you're forming plaques in your arteries, which is called atherosclerosis. There's often inflammation in those plaques. Asthma, which has an allergic component to it, has ongoing chronic inflammation. Rheumatoid arthritis or any other autoimmune disease. There is a immune response to yourself, right? So you're producing antibodies and other chronic inflammation to organs in the body. So the inflammatory system and the immune system is attacking itself. Neurological diseases, like chronic neurological diseases such as Parkinson's disease, multiple sclerosis, those are diseases that have chronic inflammation that's leading to even further damage. Okay, cancer. The body is chronically inflamed, trying to fight the cancerous cells. Okay, so very different. One's long-lasting and persistent, which is chronic inflammation. One's acute, short-lived, just wants to clear the infection or the debris and repair the tissue, which is the acute side. Okay, so chronic inflammation is inflammation that we just spoke about from a variety of different disorders. So when I think of chronic inflammation, I'm thinking of some kind of ongoing process in the body that's activating the acute inflammation that's just not resolving. Okay, so I'm thinking of a festering infection. I'm thinking of an autoimmune disease that keeps on attacking its own body, generating more and more inflammation. And there's many autoimmune diseases that cause this, okay? And the inflammation persists for months to years. What are the characteristics of chronic inflammation? Well, typically the adaptive immune system has it's been long enough that the adaptive immune system is more involved. So there's more lymphocytes, right? So plasma cells are just B cells. They're a type of lymphocyte. So they're much more prominent. There's new blood vessels coming to the area, trying to repair the tissue. There's ongoing tissue destruction from the chronic inflammation, okay? So if we were to think of, let's give an example of rheumatoid arthritis, where there's it's an autoimmune disease where there's antibodies being produced that are attacking a number of different parts of the body, the joints being one of the most common areas, and there's chronic inflammation, right? There's swelling, there's tenderness in the joints, there's redness of the joints. And over time, the most common cells that live there are lymphocytes. Over time, new blood vessels try to go there to try and heal all this damaged tissue. And there's tissue destruction, right? There's joint destruction in rheumatoid arthritis. Okay, and that goes for many other autoimmune diseases where there's ongoing tissue destruction. So some common conditions of chronic inflammatory diseases, atherosclerosis of arteries, so that plaque buildup that occurs in the vessels of our heart, the arteries of our heart, the arteries in our brain, the arteries feeding our leg, the arteries going to the kidneys. So all over the place you can get atherosclerosis. Chronic lung disease, such as asthma, there's chronic inflammation. And that's why one of the treatments of asthma is to suppress the immune system, right? With inhaled steroids to try and suppress the immune system from attacking itself. Rheumatoid arthritis, we just mentioned. Systemic lupus erythematosus is a condition where you're making antibodies and the immune system is attacking a variety of organs in your body. Okay? And we'll review these in much more detail later. Inflammatory bowel diseases are autoimmune. So the body is seeing parts of the digestive tract as foreign and attacking it. So Crohn's disease or ulcerative colitis are autoimmune diseases where there's inflammation in the bowel that leads to diarrhea, bloody stools, weight loss, difficulty absorbing food, all kinds of issues with the bowel because of the autoimmune attack on it. Okay, so we've spoken a bit about this, but we'll continue on. The causes of chronic inflammation, well, anything that persists, right? Anything that just doesn't go away. So foreign bodies. Say you have a piece of wood that you stepped on in on an old deck, and it lodged deep into your foot, and you just ignored it. You couldn't get it out. Well, that's going to set up chronic inflammation. Certain viruses or bacteria that the body has a hard time clearing can lead to chronic inflammation. Tuberculosis, very common one, right? So tuberculosis typically is a lung infection, and the body has a very difficult time clearing tuberculosis. Parasites that aren't easily cleared can lead to chronic inflammation. And of course, I mentioned before, autoimmune diseases that continually attack different parts of the body, leading to chronic inflammation. Okay, so basically anything that continues to activate the inflammatory system. So let's talk about SIRS and sepsis. SIRS is a term that we use called systemic inflammatory response syndrome, and it's really any of these, two of them. And really what it's saying is you have inflammation in your body from something, okay? And we might know the cause. Say you have an allergic reaction to something. Well, you're going to have a systemic inflammatory response. So say you were given penicillin and you had an allergic reaction to penicillin, you're going to generate a systemic inflammatory response because of the allergic reaction, which is an inflammatory process, okay? So any of these two, we could label someone as having SIRS. So if you have a fast heart rate, if you have an elevated white blood cell count, if you have a temperature, that can be an indication that there's inflammation throughout the body. Okay. When you have SIRS, or any of those two, plus a suspected or confirmed infection, we now call that sepsis. And that's important because sepsis now needs antibiotics, right? So inflammation doesn't necessarily need antibiotics, but sepsis is SIRS plus an infection that needs antibiotics quickly, okay? Because the systemic inflammatory response throughout the body is an indication that there's so many inflammatory chemicals floating throughout the bloodstream. And if it's due to a bacteria, that can be deadly, right? So sepsis can be deadly if it's not treated properly, and in particular with appropriate antibiotics, okay? So if a patient has 2 or more SIRS plus an infection, we call that sepsis, and that needs immediate treatment. So a patient that comes into the hospital with a heart rate of 120 and a temperature of 102 and a white blood cell count of 20,000, well, they have a systemic inflammatory response, okay? But then we detect or we suspect a pneumonia. We can hear it when we listen with the stethoscope. We do a chest x-ray. We can see it on the chest x-ray. So now we have SIRS plus an infection. We call it sepsis, okay? So it's not just called pneumonia because pneumonia would just cause those local symptoms. We call it sepsis because now there's inflammation throughout the whole body because the bacteria have now gotten into the bloodstream and causing all this systemic inflammation. Okay, so let's just talk about levels of inflammation and when we then call the inflammation associated with infection. So at the bottom left, there is the systemic inflammatory response syndrome. So this is your body responding to systemic inflammation. So this isn't just a splinter in your finger. This is a greater response by the whole body to some kind of inflammatory condition. Okay, so what's included in the systemic inflammatory response syndrome? Well, you may have an elevated temperature. You may be breathing a bit faster, so a respiratory rate of greater than 20. Your heart rate may be a bit faster, greater than 90. Your white blood cells might be showing a leukocytosis. You may be showing more bands, which are those immature neutrophils that come out when there's a lot of inflammation, okay? So this doesn't mean there's an infection, it just means there's a lot of inflammation occurring for some reason, okay? So let me give you an example of a non-infectious cause of systemic inflammatory response syndrome. If I run around the block 3 or 4 times, I'm going to be breathing fast, I'm going to have a heart rate greater than 100 for sure, and I may even generate a bit of a fever. So I would qualify for systemic inflammatory response syndrome. Or say I just decided to run a marathon. A lot of patients that run, or a lot of people that run a marathon will actually qualify for SIRS, but they don't actually have an infection. Sepsis is those SIRS criteria, at least 2 of them, with a suspected or confirmed infection. So now you have sepsis, which is a very serious infection, typically coursing through your bloodstream, okay? So let's say you had a inflammation on your lower leg, and it was just inflamed, it wasn't infected yet. You might have a bit of a low-grade fever from the inflammation, your heart rate might be a bit faster, your white blood cell count might be a bit elevated, but there's no infection suspected. Okay, now you come back and there's a bit more redness, there's more tenderness, there's more inflammation, you still have a fever, you have a heart rate of 120, your white blood cell count is even more elevated, and on top of that, we suspect an infection. That is sepsis, right? So not only do you have the infection and inflammation on your leg, it's generated a systemic inflammatory response, okay? And we know it's systemic because of the elevated temperature, the elevated heart rate. So it's not like just a little splinter in your finger that's not going to cause that. So sepsis is at least 2 of those criteria under SIRS with a suspected infection. Severe sepsis is sepsis, which is a confirmed infection, typically bacterial, by the way, plus signs of organ damage. So maybe your kidneys are not functioning very well anymore because of the infection. Maybe you're confused because your brain's not functioning anymore or as well. So it's sepsis plus end organ damage plus hypotension now. So your blood pressure is dropping because you have an infection that's now in your bloodstream, leading to so much inflammation in the bloodstream that you're becoming hypotensive. The lactate you'll learn about later in another semester, but lactate is an indication of anaerobic metabolism. And when you have low blood pressure, your cells don't get enough oxygen. They start to release lactic acid into the bloodstream, and we can measure it as a lactate level. So if we start to see elevated lactate in the bloodstream, that's a very strong indication that you have sepsis. Okay? Septic shock, even worse. So you have severe sepsis plus end organ damage, plus hypotension, plus your lactates elevated, meaning your cells are anaerobic. They're not getting enough oxygen, and it's persistent, right? So you're in septic shock. So there's not a huge difference between severe sepsis and septic shock. It's just one step higher in severity. Okay, so let's do a few questions before doing the last part of this module. So this question is asking what's the main purpose of inflammation? So A mentions cause pain and swelling. That wouldn't really be a purpose of inflammation. It does cause pain and swelling, but that's not the purpose of it. Minimize injury. Well, the injury's already occurred, right? So I don't think B would be an answer. C, limit infection, would definitely be one of the purposes. Generate new tissue. Well, that's what fibroblasts do. They repair tissue and lay down new collagen. Create necrotic tissue. That's not the purpose of inflammation. So C and D would be the answer. Okay, so this next question, which are classified as phagocytes? Well, so those are the cells that are in the tissue, right? So they're the cells that arrive quickly or are already there. So phagocytosis is performed by macrophages and neutrophils. Those are the main cells that perform phagocytosis. Okay, so the next question is asking about fever and which chemicals promote fever. So histamines are mainly for vasodilation and increasing permeability of the blood vessels. Tumor necrosis factor and interleukins and prostaglandins are released by inflammatory cells, and one of their roles is to circulate to the brain and reset the thermostat in the hypothalamus, which leads to fever generation. Okay? Cytokines are communicating chemicals between white blood cells, right? So macrophages, neutrophils will release cytokines to communicate with the adaptive immune system to bring in further cells. Okay, so the answer here would be B, C, and E. Okay, so the next question here, which belongs to these characteristics? Has no memory, immediate response, same response no matter the offending agent, and is self-limiting. So the immune system or the immune response, white blood cells released, inflammatory response, ligand production. So it's going to be the inflammatory response, right? It'll have the same response every time, and it won't generate any kind of a memory. Okay, it'll be immediate with the macrophages and the neutrophils, um, and self-limiting, right? Acute inflammation is typically self-limiting. Okay, so this next question. What is another way to describe opsonization? Mast cell releases histamine, proteins tag offenders, fibrin is produced, neutrophils release platelet activating factor. So the answer here is going to be proteins such as complement, uh, which are part of inflammation. They're produced in the liver, and one of their roles is to attach to foreign antigens or foreign bacteria so that the inflammatory response recognizes those foreign antigens or bacteria or viruses and destroys them. Okay, so the process of opsonization is attaching to the foreign material so that the inflammatory response and the immune response can recognize them